Okay, we are now live on Culture Pharmacy Facebook.
Okay. All right. Let's get going. All right. I'm coming live from the College of Pharmacy here in Avedisian Hall in our CVS Model Pharmacy. My name is Kelly Orr. I'm a clinical professor here at the University of Rhode Island, and I'm accompanied by Ian Lester, our technology extraordinaire, every label in the book, who's supporting me. So we both have our masks on to protect one another. While I talk about one of my favorite subjects, which is self-care. So the purpose of this lecture is to introduce you a little bit to the course I teach here at the University of Rhode Island, but also give you some trivia about the College of Pharmacy and URI. So be prepared to be interactive and answer some questions. So I'm going to go ahead and share my screen and get the slides started. All right, so as I mentioned, we're talking about the self-care course, which is PHP 315. So this course is taught in the P1 year. And so what's the P1 year? The P1 year is your first professional year of pharmacy school. So very often you could do 2 years prior. Some students may come in at 4 years. At our university, we have a 0-6 program. So you come in as a freshman and you have the opportunity to do 2 years of the pre-professionals, and then you get into your P1 year. So this particular course, we moved to the P1 year because we wanted to make sure that our students that are going out on their community experiences, their introductory experiences, have a good solid foundation in self-care prior to going out in those opportunities. So one of the other things I want to mention is we're going to look at some of the pictures on these slides. Our required text is the American Pharmacists Association Handbook of Non-Prescription Drugs. And this is available through our databases here, through the Drug Info Center. And it's through there that you can get access. It's covered with professional fees, and you can have your electronic text available on campus and also access off campus as well. So these are our course objectives: to develop and integrate knowledge about principles of self-care to patient care. And I'm going to talk a little bit about what self-care may mean to different people in the next slide. Demonstrate foundational knowledge about common self-care products. And when I say common self-care products, it's many of the things behind us. We're in the model pharmacy. You'll see on the shelves we've got a lot of products to help patients who are living with diabetes. We also have some cough and cold behind me as well. So those are some examples. The other thing we do is we work a lot in groups and we discuss the patient care process. And so we go through many cases working in our groups, and we see how we can best manage a disease state, especially from a self-care perspective. And so we use that pharmacist patient care process, which I'm going to show you a slide on as well. And again, because we're working in groups and because you work with so many different people and health professionals as pharmacists, you want to be able to communicate effectively. And so that's another goal for this particular course too. So this is the pharmacist patient care process. And this is something you're going to see in virtually every class. It's analogous to a pilot going into a cockpit and doing certain things in a certain order. We always start in a certain order when we're talking to our patients. And so for here, you would start with collect, move on to assess the patient, make a plan for that patient. Figuring out once you collect all that data, you want to find out, what the assessment is, what is going on with this particular patient, especially from a self-care perspective. Is it self-treatable, or is it something we need to refer on for more care? Then again, we make the plan. And from a self-care perspective, you might not be implementing the plan right there in the pharmacy. The patient may go home and decide what they're going to do as well. But that's still part of our overall approach. And especially when we get into more complex disease states, that implementation may happen in, let's say, a hospital setting, for example. We always want to know what to monitor and evaluate for in the future too. So when you provide that information to patients in a self-care forum, you want to make sure you tell them what to look for. What might some warning signs be if your condition's getting worse? So this is the actual definition of self-care. And I will say the term self-care is probably being used quite a bit in today's society. When you think about COVID and the impact on everyone, the term self-care is coming up a lot. Are you practicing good self-care? So again, what is the definition? It's the independent act of preventing, diagnosing, and treating one's own illness without seeking professional advice. It could include, but it's not limited to, the self-administration of non-prescription drugs. And that's where this course comes in. We also have many of us that are working towards preventative self-care. And this is really, again, where you're hearing a lot of this today as we're dealing through the pandemic. And this is maintaining your well-being and appearance through exercise, healthy lifestyle. For example, yoga and meditation might be ways that you might be using self-care today. And then also from a pharmacy perspective, we have sickness self-care when patients are coming in with acute illnesses. So they're diagnosing their conditions and obtaining products for the goal of mitigating illness or relieving symptoms. And this could be cough and cold, for example. Here's another depiction of what self-care may look like. It may change throughout time, because if you look at one end of this, your daily choices are, you're responsible for your own self-care. But as you become more towards the more major traumas, long-term illnesses, self-care may still play a role, but not as heavy as a role. And so this is what we call the self-care continuum. We have healthy living, minor ailments, which again is very much where people are coming into the pharmacy. Long-term conditions can also include self-care as well. For example, diabetes is a long-term condition. Behind me, you see diabetes monitors to help with their blood glucose. Also in hospital care, there may be less self-care involved there. Here's another depiction also from the textbook, many different ways in which we have self-care involved. And you'll see, for example, self-care for maintenance of good health and lifestyle and prevention of ill health. And these include health literacy, prevention of ill health, and again, through diet and exercise, maintaining physical and well-being and mental well-being, self-diagnosis, problem solving, effective communication, active citizenship. And you'll see to the right there, we have the gray, which is where you're doing things towards your own self-care. But outside of that, you may need more professional help. You may need more help with your healthcare providers in order to manage your disease states. So let's do a little bit of trivia about what self-care is, and also talk a little bit about URI. So this is my first one. I'm going to get my poll up and launch it. And so recently, the University of Rhode Island was celebrating a milestone anniversary. So it wasn't this year, I apologize. But what year was URI established? It was something that happened recently. So if you could go ahead and pick, was it 1842? Was it 1892? Was it 1917? Or was it 1967? Well, I'm going to end the poll. So it looks like a few people, well, everyone who participated got the right answer. And the right answer is 1892. And actually, you can get a very detailed history of the University of Rhode Island on the URI website. A little more information going on here is that we actually celebrated our 125th anniversary in 2017 at the University of Rhode Island. Now, the College of Pharmacy was actually brought to URI in 1957 from Providence, Rhode Island. And it moved down here from Providence, and the founding dean was Dr. Heber W. Youngkin Jr. And so in 2007, the URI College of Pharmacy turned 50, and there was a big celebration for that as well. Now, I say that name, Dean Youngkin, because that's going to show up later in the presentation. All right, so question number 2. Annually, Americans spend the most money on non-prescription medications for which of the following categories? So I'm going to launch this poll as well. Is it analgesics for pain or fever relief? Gastrointestinal products? For examples, there would be heartburn and constipation. Respiratory treatments, cough, cold, and related products? Or is it oral care with toothpaste and floss and other things of that nature? So I'm going to give a few more seconds for people to vote. And it's okay, you don't have to get it right. This isn't a test. So we've got a couple of different answers coming in here, which is great. Okay, so a few picked oral care and one person picked the analgesics. I'm going to end that poll. We're going to move on because the next slide we'll talk about it. And this is actually where everything sits. So here it's respiratory is where we spend the most money at $7.7 billion. And so the bottom line here is that consumers can benefit from prescription to non-prescription switches. So these OTC products, over-the-counter products, because they brought in access to important medications. In addition, non-prescription versions are usually cost-effective for consumers and also helps because third-party insurers don't usually pay for them. But again, if most people can afford them, they have access to them, it becomes a benefit. A survey found that consumers save up to $750 million a year using non-prescription cough and cold medications that were once available by prescription. And so that's where we see lots of different medications being used. All right, I'm going to move on to my next question. Launch this poll. And it's question number 3. And it says the former CEO of which of the following companies is a URI College of Pharmacy graduate? And so the choices are Walgreens, which is also Boots Alliance, Rite Aid Pharmacy, CVS Health, and Walmart. I've got some quick answers going on here as I sit in the CVS model pharmacy. And so yes, it is CVS. And so we're going to end that poll. Lots of people got that one right. And it's no wonder because Tom Ryan, who is a graduate at the URI College of Pharmacy, was actually the former CEO of CVS. And so you'll see definitely a CVS presence here at the University of Rhode Island. But also Mr. Ryan himself has a mark here on the university. And so you see the Ryan Center where we have our wonderful basketball games and many other events. We also have the George and Ann Ryan Institute for Neuroscience, which is also associated with the College of Pharmacy. And there they do wonderful research in Alzheimer's disease and brain health. We also more recently, and this is what this slide is depicting, is Mr. Ryan has established the Ryan Scholars. And so these are scholarships, which are 4 years, and students who get these scholarships also have other opportunities, such as being participants in the Honors Colloquium, Leadership Institute, and also a winter J term experience. So moving on to the next slide. Okay, here's another self-care question. And I'll launch this poll. Question 4. Which of the following prescription medications has most recently become available over the counter? So OTC. So is it Differin gel for acne? Is it Voltaren gel for arthritis pain? Is it Rhinocort allergy spray for allergic rhinitis? Or is it the Oxytrol patch for women? All right, and a couple different answers. All pretty good because they're all pretty close and actually when they came out. Okay, so the answer here is the Voltaren gel, and this actually was approved for OTC use in February 2020. So very recently, one of the first topical non-steroidals to be available through a non-prescription avenue. And so within here, we've mentioned a couple other drugs, Differin, which was actually approved in 2016, the Rhinocort spray for allergies, which was approved in 2015, and you'll see similar products available, such as Nasal-Cort, for example, Flonase, and also the Oxytrol patch, and that was in 2013. So again, this is the newest thing to move over the counter. Since the mid-1970s, the FDA has switched more than 100 ingredients, dosages, or indications from prescription to non-prescription status. So that's a huge amount of medications that are now available as a non-prescription product. So next slide we have, and I'm going to launch this poll again. So this is question 5. Which of the following non-prescription medications is stored behind the pharmacy counter in all 50 states? And the choices are dextromethorphan, phenylephrine, naloxone, and pseudoephedrine. So we've got a couple answers coming in here. And I will close it. So a couple good answers. So naloxone and pseudoephedrine. And actually the answer is pseudoephedrine, but I'm going to go back to naloxone because I think that's a pretty common thought, is that it's available as an over-the-counter drug. Just to go back to pseudoephedrine, this goes back to something called the Combat Methamphetamine Epidemic Act, which went into effect in 2005. And the reason is that pseudoephedrine in itself was being used to manufacture methamphetamine. And so it has a limited of quantities in which anyone can buy, and the purchaser has to show their ID and also log in an electronic or written logbook. So we have very limited quantities, but it's a great medication to help with congestion. And so you want access to this, you just simply have to ask the pharmacist or a technician behind the counter in order to get this, and they will record your sale. Now, phenylephrine, which was on there, is also used for congestion. It's also available. Some may feel it might not work as well, but pseudoephedrine is something that you can ask for as well. Dextromethorphan for cough has also been known to be abused. And in some states, there are laws that it has to be stored behind the counter. But universally across the United States, it doesn't need to be stored behind the counter. Another thing that's stored behind the counter, which is OTC, is insulin, regular insulin and NPH insulin. And many people don't think of that as over the counter, but that's another example that could be used here. Now let me talk about naloxone, because naloxone has been in the news quite a bit. It helps reverse overdoses that occur from opioids, and it helps prevent deaths, which can be one of the leading causes of death by injury in the United States. And so it's still a prescription-only product. So we've seen expanded availability in various states by standing protocols, but also things known as collaborative practice acts. And so these collaborative practice agreements, can be implemented within pharmacies where the pharmacist may be able to dispense this to patients when they come in. So it's different in each state, but the FDA would like to see the expansion because, again, this is a life-saving treatment, but technically it's still a prescription at this point. I'd also like to mention that we have a URI first responder program that one of our faculty, Dr. Anita Jacobson, has put together, and there's a link there to her website if you'd like to learn more about that. All right, question 6. Let me launch this poll. Here we have, which of the following non-prescription medications is often added to products as an additional sleep aid? An example here being Tylenol PM or Advil PM. So is it loratadine, cetirizine, diphenhydramine, or fexofenadine? All right, we've got 100% consensus here. It is diphenhydramine. These are all considered antihistamines, but diphenhydramine is a first-generation antihistamine. And so with that comes some properties which can induce sleepiness. And so you may see products. So for example, here it's an acetaminophen PM. When you see that PM suffix, it often means that there's another product involved in it. So here it could be diphenhydramine, could be doxylamine, for example, to also promote sleepiness. So you'll see here there's a combination product with the acetaminophen and the diphenhydramine. Now, you'll see on this particular package, it also talks about new warnings information about different ingredients in here. And this goes with acetaminophen. There have been some more warnings about acetaminophen because it is in so many products, both over the counter and prescription. And so you need to be really careful that you're not taking too much acetaminophen. And so the American Pharmacists Association, again, the group that publishes our textbook, has a campaign to knowyourdose.org. And so again, looking at see what medications you may have at home in your medicine cabinets that contain acetaminophen, because you don't want to take too much of it. All right, getting towards the end here. We are at question 7. And which of the following can be found on the URI campus? A botanical garden, a medicinal garden, an arboretum, or all of the above? So I'm going to give another few seconds. I see some answers already associated with this. Oh, definitely see medicinal garden. All right, I'm going to end this poll. The answer is actually all the above. We have all 3, and here's a beautiful picture of our URI Botanical Garden in Horridge Conservatory. We also, again, have an arboretum. And so what is an arboretum? It's basically an outdoor living tree museum. And so it's a special botanical garden specializing in trees. And so here you often see students outside learning about these many different trees, and they have the labeling throughout the campus. Also, we have the Heber W. Youngkin Medicinal Garden. Do you remember that name, Heber Youngkin? Yes, that is our founding dean. And our founding dean was actually an expert in what we call pharmacognosy. And so what is pharmacognosy? It's the study of medicinal drugs from plant sources. And so we have several faculty that look at natural products and how these chemicals within these natural products can be derived into medicines. Here's also a picture of our beautiful Youngkin garden at night, and we see the etching of various botanicals on the glass within the garden. I bring this up because in self-care, we actually go into the medicinal garden. We have dietary supplements that we talk about that are available in the pharmacy as well. And even though they're not technically OTC, they are available as a dietary supplement that one can use in a self-care sense. So right here, we see several of our students out on their first day of class doing a scavenger hunt in the medicinal garden. All right, moving on to the last question. And question number 8 is, which of the following non-mineral, non-vitamin dietary supplements is reported as one of the most commonly used? Is it red rice yeast, lemon balm, omega-3 fatty acids, or turmeric? So getting a couple of different answers. And so some of these things might sound really familiar to you because you might see them in the store when you go to your local pharmacy. And so I'm getting some omega-3 fatty acids and also turmeric. And so the answer is actually omega-3 fatty acids found in fish oil. And this comes from the National Center for Complementary and Integrative Medicine, Integrative Therapy. And this was a 2005 publication. And this is also from the National Health Interview Survey, which is one of the ways that the United States monitors everyone's health and well-being. And it's something they've been doing since 1957. So you can see there's various botanicals on here as well. Even though omega-3 is not necessarily botanical, glucosamine and chondroitin, neither are pre or probiotics, but we've got echinacea down at the bottom, cranberry, garlic supplements, ginseng, ginkgo biloba, just to show you a couple of different things that you may find in our garden. Now, while we're talking about the National Health Interview Survey, also noted is that in the last few years, we've seen a great uptick in yoga and meditation. I mentioned in the beginning that this might be something that someone may do as preventative self-care. And so this one is specifically for adults. Since they've done the 2012 and 2017 surveys, they've seen a great increase in both, again, yoga and meditation, but we've also seen that increase in children as well. So while I'm on this topic, let's talk about how we do yoga and meditation here at the College of Pharmacy. We actually have a number of faculty who are instructors, and this one was led by my co-coordinator for self-care too, Dr. Ginger LeMay, who again has done self-care yoga sessions with our courses. And so here you also see our dean and some of our faculty outside in pharmacy quad doing a yoga session. And here is another one just a few weeks ago. Everyone is masked as well because we're very safe here. And that brings me to the end of my presentation. I hope you enjoyed learning a little bit about self-care and also about URI in the College of Pharmacy. If you really liked self-care, I'll be doing another one on November 10th. We'll be doing a live lecture at 9:30 in the morning on stings, bites, and pediculosis. Pediculosis, oh my. And we also have several events upcoming, including our high school day, which is November 20th. So please visit us here at the College of Pharmacy. We look forward to seeing you soon. Thank you.